recovers quickly. And that's something obviously we look at very carefully. For the 24-hour reporting period, there have been 583, happily, folks who are discharged. Looking at this graph, we are seeing relative stability in the number of patients in critical or intensive care. Again, stability, whereas hospitalizations have begun to show more of a downward trend. Now, the two slides to come are the most important to us as we begin our planning for the next several weeks. They begin to give us our clearest indication of the path ahead. The number of newly hospitalized patients is moving, as I said, on a downward trend. This is one of our most important positive indicators. It means that our healthcare system is in a better position to be able to get ahead and stay ahead. It means that our aggressive social distancing efforts are having their desired effects. These are real numbers. This is reality in our healthcare system. And it means that as new cases are identified and as we take steps to ramp up and expand our testing regime, we will be in a better place to capture and contain COVID-19. While there is no doubt that the lack of either a federal plan or real federal support for tests and PPE, both of which, by the way, are essential to robust testing, there's no doubt that that has inhibited our testing efforts. The numbers on hospitalizations are a definitive measure. In other words, we could speculate all we want, and we do a lot of it, in terms of modeling about what the denominator looks like. We try to get at that, obviously, through as aggressive testing as we possibly can. We're the fourth highest tested state in America, but it still is not remotely close to what we need, particularly from the outset from the feds, to get universal testing. So we're always debating and wargaming and modeling what's the actual denominator. There's no wargaming here. These are facts. These are folks who are hospitalized. This data helps inform our decisions as we look toward a reopening strategy, as we look to prepare for a spike that will surely come when we do reopen, and for a potential recurrence of this virus later this year. We must prepare for all those scenarios.
All right, everyone, we did lose that shot right there. We'll try to get it back for you right here on News Now. But let's go on to still a live event happening right now in Chicago. Let's bring it to you right here.
Westside United is leveraging the work of our anchor institutions who are currently employing strategies like the Rush University Medical Center Command Center, which deploys information, volunteers.
All right, and it looks like we did get it back here for you. Back out to New Jersey.
Charges continues to outpace the numbers from intake. Please God, may it stay that way. These lines intersected for the first time last week, and we can now see a trend emerging. Please, let's hope it stays that way. This did not happen by accident. We planned, we worked, and we collaborated. We worked with our hospitals and with the U.S. Army Corps of Engineers to increase hospital bed capacity. In fact, Judy, Pat, and I, among others, will be in Atlantic City tomorrow morning, 9:30, is that right? To tour the Atlantic City Field Medical Station. We worked tirelessly, as did our healthcare providers, I might add, to get more ventilators and to adapt existing equipment. We are not by any means claiming victory, but we are making progress. I want to thank everyone in our administration, in the healthcare community, and in the federal government who have joined together to get us this far. And we have much further to go. And as if we needed a reminder as to the gravity of the challenge still before us, sadly today we must report another 177 COVID-19 related deaths, and the total number of lives lost now stands at 4,377. 177 precious lives lost. Among those we have lost was Ambassador Fode Mansoure of Franklin Township, Somerset County. Ambassador Mansoure was a representative of the International Human Rights Commission Relief Fund Trust and Deputy Foreign Minister and High Representative to the United Nations. He was a strong advocate for his native Sierra Leone, and especially for our states and our region's Sierra Leonean and West African communities. He put his community before himself and was always thinking about how else he could help others. He is remembered by friends and colleagues as a kind and hard worker whose boundless energy and sense of humor spread to all who happened to be around him. To his wife, Patricia, with whom I spoke yesterday, and their family, I extend our deepest condolences, and our entire West African community is in our thoughts and prayers. Bill Thuckman, there he is, was a longtime resident and community member in Maywood. He was just shy of reaching his 95th birthday. Born in Jersey City, Bill enlisted in the Army in 1943, and throughout his 3 years of service, quite literally traveled around the world. Returning home in 1946, he went back to his prior job at the Borton Company and met Anna, who he would marry in 1948 and with whom he would share his life for the next 71 plus years. Bill and Anna settled in Maywood in 1950, which they would call home for 68 years, and he went back to school on the GI Bill and got a degree in accounting. He would retire for good in 1990. Bill and Anna again lived in Maywood for 68 years. Bill was a life member of Maywood VFW Post 7408 and served as its quartermaster. He was a member of the Maywood Pool Commission and helped organize the annual July 4th parade. Besides his beloved Anna, with whom again I spoke yesterday and had that honor, he leaves 4 children, William, Robert, Carol, and Janet, and their families, which account for Bill and Anna's 10 grandchildren and so many nieces and nephews. May God bless him and each and every one of them. I'd like to remember Anna Gaffney, mother of a dear friend of both mine and Tammy's, among so many members of our team, Jerry Generone. Anna was 81 when she passed away this weekend due to complications of COVID-19. Anna was born on the 4th of July, as my mother-in-law was, in this case 1938, in San Sebastian, Puerto Rico, and came to the mainland U.S. at the age of 13, settling in the Bronx, where she would eventually meet her husband, Edward. The couple would eventually move to Sussex County, where they raised 6 children before retiring to Ocean County. She was a successful business owner and a passionate advocate for those in need. And from our friendship with Jerry, I know Anna passed these values on to her children. So to Jerry and her entire family, you are in my and Tammy's and our entire team's and family's prayers. And finally today, we must note the passing of Ray Kenny, who until his death Saturday was serving as Senior Vice President and General Manager, Rail Operations at New Jersey Transit. We had hired, notwithstanding our great cooperation with New York during this entire crisis and during most times, we had stolen Ray from Long Island Railroad and thought we had a real coup in our hands a couple of years ago, and in fact we did. He was a key member of our team immediately, working hard and making progress in restoring NJ Transit's trains to where we know they can be and where we need them to be and where they will be. He was a really good guy, and we will miss him dearly. I spoke to his brother, Ed.
That was the governor of New Jersey talking about the passing. Just so many there in New Jersey, some key members in that state as this pandemic continues to sweep the country and the world. I want to take you right now out to the market here. You're taking a look here. We're almost down 500 points. Big news happening with the U.S. oil's May contract as it has plunged more than 150% today, meaning that you have to pay to get someone to take barrels of oil off your hands. West Texas Intermediate oil trading on the New York Mercantile Exchange plunged 154% to trade at negative $10 a barrel. The May contract expires tomorrow, so we'll keep an eye on that. That is big developments there. That one-day drop would mark the first time the contract is traded negative in history and would be the largest on record going back to 1983. So we'll keep an eye on that here for you right here on the News Now, everybody. Let's keep the coverage going, though. Let's go out to our sister station, Fox 32 in Chicago. This is some of their newscasts from earlier.
For the first time since the coronavirus pandemic spread to Illinois, parents and students are waking up on a Monday morning knowing they won't be going back to school this year. And now a decision on that stay-at-home order likely just days away. Good day, Chicago. It is Monday, April 20th. I'm Sylvia Perez, and welcome to the 9 o'clock hour. After shutting down schools for the rest of the academic year, Governor Pritzker says he expects to make a decision on the fate of the statewide stay-at-home order sometime this week. It is widely expected to go beyond April 30th, but it's not clear just how far. We're going to have much more on that throughout the hour, plus a local emergency room getting back to business this morning.
I'm Joni Lum. A Chicago hospital emergency room reopened after it was shut down for 2 weeks during the coronavirus pandemic. That's coming up.
And I'm Brittany Payton. We continue to get your questions answered by our panel of experts this morning. We'll be speaking with a family law attorney about how to navigate the pandemic as a divorced parent. The answers to your viewer questions coming up this hour.
And it's pivoting its production to support those who need it most. How Windy City Plastics is using its unique talents to help first responders stay safe. We're going to get to all of that for you throughout the hour. But first, let's get you caught up on the day's headlines. Here's where we now stand. There are just under 1,200 new cases of coronavirus in the state, bringing the total to more than 30,000. Governor Pritzker also reported 33 new deaths yesterday. Though the curve does appear to be bending, a weekend poll finds 60% of Americans are concerned the country will reopen too quickly. These results coming in as parts of Europe gets back to business this morning. Kindergarten is resuming in Norway, and Poland is opening up its parks. In the meantime, Los Angeles Mayor Eric Garcetti says thousands of city workers will be taking forced furloughs. The lost wages will result in a 10% pay cut. Back here at home, a second airlift of PPE is set to arrive in Illinois today. The governor says the Illinois National Guard will handle the ground transport of millions of masks and gloves for healthcare workers and first responders. This shipment is the second to come from China in the past week. A local emergency room is getting its services back online this morning, and this after the ER was closed earlier this month for upgrades. Joni is live at Provident Hospital with the latest on this. Good morning, Joni.
Good morning, and there's some activity out here on the apron of Provident Hospital. Right underneath that overhang, you can see that there are some medical professionals, and I'm told that this is going to be a drive-through testing facility by appointment only, but it appeared that they were getting a little bit of training here. You can see that they're all suited up in their PPE. They have a table out and some supplies, and they're ready to go. Provident just reopened its emergency room after it was closed for a couple of weeks, and that closure was kind of controversial because it caused an inconvenience for the patients and some of the workers as well. Earlier this month, nurses and other hospital employees protested this closure. They said they were told on a Friday that it was going to close on Monday, and it wasn't enough for notice for them. But they did have to close it to equip isolation areas, make more space for future demand here. The nurses don't dispute those improvements were needed. They said that closing the ER put the community at risk, and we have not heard if in the last 2 weeks there have been any problems. But they are very concerned because this happened at the same time that it was disclosed that black residents are dying at disproportionately high rates, making up 60 to 70% of coronavirus deaths. So now Provident, by the way, Provident is a Cook County hospital, and it reopened the emergency room, which is behind this area, at 7 o'clock this morning. I'm told that all the improvements that were made inside at the emergency room. Providence said that they kept their clinics open for people who needed them in the area, but now the emergency room and apparently the drive-through testing are open. Live on the South Side, I'm Joni Lum. Now back to you.
Okay, thank you, Joni. 5 northern Illinois mayors have asked Governor Pritzker for the authority to reopen business as soon as next month. The Winnebago County leader sent a letter to the governor last week. They say thousands of employees are being unnecessarily harmed because they are not considered essential workers. They are asking that small businesses be allowed to reopen using common sense modifications. This request comes as communities nationwide are seeing protests demanding stay-at-home orders be lifted.
The fact is that we have got to be very careful as we make decisions about change in the stay-at-home order to keep people safe. And I'm looking at all of the ways in which we can open things up and keep people safe.
The governor expects to make a decision this week on whether he will extend the stay-at-home order. A second employee at the Symphony of Joliet Nursing Home has died from coronavirus. The Chicago Tribune says the home is not providing further details at this time. The Symphony has seen a major outbreak of the virus. 21 people from there have died from it, and 81 have been infected. Joliet's mayor has called for a state investigation. A suburban high school student appears to have died from coronavirus. The family of Wheeling High School student Zach Leviton says he became sick last month, but the 16-year-old's symptoms didn't mirror that of the virus. He didn't have a fever or a cough. His mother says the teen only complained of being lightheaded, and a coronavirus test came back negative. He died 1 week ago, and the investigation remains open. If it was COVID, Leviton would be the first teenager in the state to die from this.
Obviously, a 2-year-old and a 17-year-old are all considered pediatric patients, but we know that the 17-year-old has the physiology much closer to an adult than, say, an infant or a baby. And so, as I know that, at former hospitals that I've worked with and pediatricians that I've talked to, they have seen severe illness in older pediatric patients as they look more like adults than babies.
Another student from District 214 is also in intensive care this morning with coronavirus-like symptoms. A deal on an emergency relief package for small businesses could be approved by the Senate today. The money replenished the already depleted payroll protection program. Its initial $350 billion in funding reached its limit last week. This deal would include $300 billion in new funds for businesses to pay their employees. Well, beginning today, Walmart workers will have to start wearing masks. The new rule applies to stores, clubs, distribution and fulfillment centers, as well as corporate offices. Customers will not be required to wear a mask, but they are encouraged to do so. And Neiman Marcus is set to reportedly prepare to file for bankruptcy this week. Reuters says the chain is in final negotiations with its creditors. It would be the first major U.S. department store to collapse under the economic fallout of the pandemic. All of the company's stores are closed for now. It also furloughed its 14,000 employees. As we reported last week, JCPenney is also considering bankruptcy. The FDA says disinfecting food packaging after going to the grocery store is not necessary. Officials say there is no evidence of packaging being associated with the transmission of the virus. It does still recommend washing your hands before and after putting groceries away. And as always, it is a good idea to wash your produce with water. However, if it makes you feel better to wipe everything down, the FDA says to allow it to air dry afterwards. Well, if you haven't done enough binge watching while stuck at home the past month, then it might be just the gig for you. A streaming service called Magellan TV will pay someone to watch 16 true crime documentaries in 48 hours and talk about it on social media. Titles include Last Confessions of the Cannibal and Parachute Murder Plot. Along with the cash prize, the winner gets a 1-year subscription to Magellan TV. Applications close on May 4th. Let's find out what's happening with our forecast today. Been getting a lot of gorgeous beauty shots outside. Caitlin, another nice day. How was your weekend?
Oh, it was great. Yesterday it felt wrap. Maybe you were outside yesterday, enjoyed the mild.
And a reminder, you can always stay on top of the latest coronavirus developments with the Fox 32 News app. It's constantly updated and features everything you need to know. Just search Fox 32 Chicago on the App Store or Google Play. Also trending downwards, but Cuomo warns it could only be halftime in this fight.
We still have a long way to go and a lot of work to do. And this virus has been ahead of us every step of the way. We have been playing catch up from day one in this situation.
New York's stay-at-home order was recently extended to May 15th. The governor warns that easing it depends on dramatically increased testing. In the meantime, there is a call today to end subway service in New York City. At least 70 transit workers have died of coronavirus, and thousands others have tested positive. Advocates say suspending service would protect both workers and riders, but New York City Mayor Bill de Blasio says the move would only hurt essential employees who use the subway to get to work. Well, many businesses, as you know, have adjusted their production amid the COVID-19 pandemic to help doctors, nurses, and hospitals in need of coveted PPE, and that includes Windy City Plastics. It is a Chicago-based company that normally creates merchandising products for businesses. Well, now it's creating medical protection boxes. And joining me via Skype is owner Keith Bosker. Keith, thanks for joining us today.
Thank you. Good morning.
Okay, so we have a picture of this box that I want to call up immediately so people can see what we're talking about. We first became familiar with this when we spoke to an ER doctor who told us that he had been using this plastic box. So tell me, you've never done anything like this before. Tell me how the story takes place and how this box became a reality.
So a friend of mine who's an anesthesiologist sent me a photo of this box that was actually created by another anesthesiologist in Taiwan. And so he sent me the drawing of this and asked if I could make a box for him. So I said, yeah, sure. Went to work the next day, made one for him, brought it home that night. Actually made a couple of them and gave one to him and then one to another friend of mine who's an ER doc. He lives in my neighborhood. And they were both very excited to get it. So they went, took them to the hospitals, tested them out, and made a few modifications. The one photo you're showing with the one wide open hole, that's my friend Jamie Maher helping me out. That was that one hole was suggested by a ER doc, a friend of mine. And then there's that angle on the front that was the anesthesiologist doc that came up with that one.
So it was a team effort. And it just
morphed into something really big from there.
Yeah, and so tell everybody how these boxes are used exactly. What's the purpose?
So the purpose is, it's mainly for when the patient is intubated. What happens is they kind of cough or they kind of aspirate when they do it, and it contains the virus. So the aerosolized air that's out, it kind of contains it. So there's usually like a sheet on the other end.
And you,
so if you
go ahead.
So the doctor will put it over the head. They'll stick their arms in, and they'll probably put a sheet over the other end, like a surgical sheet, and then do the intubation from there.
Yeah, and it basically stops those droplets we've been hearing so much about from spreading.
It contains them within the box.
Yeah.
Yes.
Okay. So what kind of reaction have you been getting? Because I understand more doctors are asking you to make some of these for them. Are you guys producing these regularly now?
Yeah, we are. So we've been shipping them all over the United States, and the response has been very positive. We've had doctors from all over the Chicago area pick some up here at our shop in the kind of the back dock area. I've taken some home. They picked them up in my driveway. The response has just been, at first it was just overwhelming.
Mm-hmm. Well, what's even better about this is this has enabled you to keep some of your employees working. Is that correct?
That is correct, yes. So normally we probably would have just closed down after Governor Pritzker gave the mandate, the stay-at-home mandate. But then this came up, and so we have about 14 employees, and so we bring in maybe 5 to 6 employees every week, and we kind of rotate the shifts just to practice social distancing, and then also give them a paycheck too.
Well, you're getting a double good whammy out of this because you're helping to keep the employees who have been loyal to you, and you're helping our first responders to try to stay as safe as they possibly can. So I'm curious, what is the future of Windy City Plastics? Have you learned anything about this experience that might take you into the future in a different direction?
Yeah, I just, I've learned to probably rely more on friends, my employees too. Just been fantastic through this whole thing. I don't know where this is going to take us. Mm-hmm. Who knows?
Yeah.
This is something new. We've always been in point of purchase retail. We do some stuff for the restaurant industry, and both of those have been hit pretty hard. So right now, the future is up in the air, and hopefully it's going to be bright.
Hopefully it will be bright for you. I love that you have transitioned into helping so many people. Thank you so much, Keith Bosker with Windy City Plastics. A pleasure to talk to you. Have a great day.
Take care.
You too.
Bye.
Coming up, the coronavirus pandemic taking a toll on more than just the patients fighting the disease. Up next, we're speaking with a man who specializes in emotion.
All right, so we were listening to some of the coverage there from our affiliate, Fox 32 in Chicago. Let's continue to bring you the very latest live back on New Jersey.
That they should report suspect outbreaks immediately to their local health departments, This will enable the local health departments to assist facilities in assessing the outbreak and put proper infection control procedures in place. Now for today's report, our hospitals reported last night 6,986 hospitalizations, which includes COVID-19 positive patients and persons under investigation. This is a 5% decrease in the growth rate. There are now over 2,000 individuals in critical care. 1,592 of those individuals are on ventilators, or of about 82%. Again, you may recall we were as high as 97%. A total of over 11,000 COVID-positive patients and persons under investigation have been discharged since March 31st. Our field medical sites continue to serve individuals who no longer need to be in the hospital. More than 200 individuals have been served at the Edison and Secaucus sites. Yesterday, at the Atlantic City site, which we will be visiting tomorrow, a training took place for 80 medical personnel and other staff who will be working there. And we expect that site to start serving patients this week. I had the privilege this morning of visiting the alternate care site at the hotel in Secaucus. Today, they have 32 patients. 9 are COVID-positive healthcare workers, and 23 are COVID-positive patients who came from the Secaucus federal site or the Edison site. Many of the patients coming from the federal medical sites are medically and socially complex, and for many reasons cannot be supported in their homes. We have a patient who is blind and needs more assistance while she quarantines. We have several patients with complex chronic illnesses, such as diabetes, hypertension, and asthma. We have patients with significant mental health disorders, including depression and anxiety, and very few social supports at home for them. Many of the individuals there do not speak English. They're exhausted. Some are still feverish and have shortness of breath, and they are separated from their families and support networks, and the team there is providing them that support. Several were most recently staying in homeless shelters. The care team at this alternative care site is caring for everyone. They're accepting new admissions daily, and the census continues to grow. This site is being led by Dr. Jeff Brenner and Kathy Stillo, who are on loan from United Healthcare. Cooper University Healthcare is sharing Rachel Adams to temporarily work as the chief nurse officer there. There is an APN, advanced practice nurse, that I met today, and along with Rachel, I'm proud to say, they are both Rutgers graduates. The staffing agency, Horizon Healthcare Staffing, that came to us through the portal has been amazing to work with. The teamwork at this site has been extraordinary as they establish this innovative model of care for perhaps those who have been left behind. Today we're reporting 3,528 new cases for a total of 88,806 cases in the state, and sadly, as the governor shared, 177 new deaths. Of the deaths that we are able to investigate, 43% are female, 57% are male. 50.5% are white, 21.8% are black. 16.6% are Hispanic, 5.7% Asian, and 5.4% other. As reported previously, 60.7% have an underlying cardiovascular condition, 39.3% diabetes mellitus, 30.2% other chronic diseases, 19.8% chronic lung disease, asthma, emphysema, COPD, 15.8% chronic renal disease, 15.2% neurological disability, 13.7% other, and 11% cancer. Additionally, 27.9% are associated with long-term care facility clusters or outbreaks. Overall, in our mortalities, 40% are associated with long-term care facilities. The VA homes at Menlo Park and Paramus still continue to be stressed. We continue to monitor them. On a call yesterday with the VA, they are sending individuals in to help both at the Paramus site, first and foremost, and also the Menlo Park site. The Menlo Park site reported between yesterday and today 1 additional death. The Paramus site has reported 6 additional deaths. We thank the VA for the support that they will be giving us over the next 2 weeks. According to data from this morning of the 7 laboratories sending us COVID-19 results, 161,714 individuals have been tested, 72,463 have tested positive, with a positivity rate of 44.81%. In closing, thank you again for staying home and maintaining social distancing. It is making a difference. Stay connected, stay safe, stay healthy, stay doing your part in saving lives in New Jersey. Thank you.
Judy, thank you for this and for all. Just a couple of quick follow-ups, may I? Counties, again, positive cases. That's the same 6 that lead the pack in order: Bergen, Hudson, Essex, Union, Passaic, Middlesex. The race statistics are about where they've been. Again, concern in particular about the African-American number, which looks to be about 50% higher than the overall representation in our society in New Jersey. Veterans, while there are a couple of positive cases, one piece of good news continues to be a largely meaningfully better picture in Vineland, and that continues to be the case. Is that fair?
Yes.
Yeah. And so Menlo Park and Paramus is in fact where the VA has come in to help us surge. And by the way, they have said, God forbid we need it in Vineland, but they would also find a way to help us there if we needed it. Mahan, correct me if I'm wrong, just get this out of the way before I forget. Tomorrow, we're not only going to be in Atlantic City in the morning, I'm then going to tag on. I'm going to keep going south to look at some of the storm damage from last week, which means we'll be here at 3 o'clock tomorrow. Is that correct? Okay. And then on Wednesday, to be determined, I know, but we are trying to coordinate with the Army Corps and look at some of the northern facilities, not field stations, but places where they've reconfigured or reopened wings, etc. So that's still a potential for Wednesday, which means we'll be again 3 o'clock if that happens here as well. So forgive us for the next 2 days. We're going to be a little bit later than normal, 3 p.m. tomorrow and 3 p.m. on Wednesday, but if that changes, Mahan will come back to us. With that, Pat Callahan, anything on PPE, compliance, infrastructure, beds, other matters? Thank you.
Thanks, Governor. Just for the weekend compliance report, a subject who had heard that they were going to open up a testing site at a local pharmacy went on Facebook and threatened to basically run people over. The part about this story that's important is that people saw it on Facebook and did the right thing and called the police. They subpoenaed the IP address, went to the subject's house where he did admit to making the post, but indicated he did not have any intent to harm anybody. Over 4 different events over the weekend in Patterson, 14 different individuals were cited with EO violations. Again, 4 more gatherings than we'd like to see, but again, generally overall compliance pretty good. In Newark, 19 EO violations were issued, along with 3 businesses being shut down. In South Brunswick, 4 subjects were cited for burglary and EO violations. In Lambertville, a subject was cited for being in a closed state park. In Passaic, again, another large gathering where the owner of the home was cited for the EO violation. Jersey City, another subject, actually 7 subjects charged with being in a closed park. In Plainfield, a non-essential business was closed. And in North Vale, subject had been warned 2 previous times, and yesterday was subsequently charged with EO violation and defiant trespass since she'd been warned 2 times previous. And lastly, just the subject charged with driving under the influence was also charged with the EO violation. And just to echo with regards to Atlantic City Convention Center, the staff that's come in from the Department of Defense, as well as I think the Commissioner's shop in DOH has hired 15 civilians to help support the Atlantic City Medical Station. About 28 of those staffers have also been shifted over to Salem Medical Center to support the caring for patients that we've shifted down from some of our northern hospitals. So it's they're kind of splitting their duties and supporting us and being flexible, which is greatly appreciated. That's all I got, Gov.
Pat, thank you. Again, I'm going to start with Sam. I don't know who's got the mic. Martel, is that you? How are you? Martel, I think, has been here every day since we've started. Would love to ask you to please consider 3, maybe 4, if they're short questions at most each. We've got a big crowd today, and we're under the gun. Not yet, not quite there. Secondly, compliance to the knuckleheads who've been called out. They deserve to be called out for that kind of behavior, running people over at a testing site. I mean, you've got to be kidding me. What are people thinking? But for the most part, folks are overwhelmingly doing the right thing, and bless you and thank you for that. We just need you to continue doing that. And it's our job to be straight with you, to give you a sense of the road ahead of us. And I think you're starting to see that we're seeing some light here, but the human behavior factor has an impact in those charts, those numbers, those personal stories, unlike anything I've ever seen before. I'm concerned, as we all are, about ridiculous behavior, the likes of which, Pat, you describe. Unfortunately, we've got an example or 2 every day. I'm also concerned, I think we all are, about more benign behavior. My kid's 7 years old, not getting it's not the same experience at home as it is in the school building, and that's a worry and a pressure. There's the I lost my job, or I've got an enormous financial pressure, even if you didn't lose your job. And then, of course, there's the healthcare reality of this silent killer that's taken 4,000 plus lives in our state already. And so that, at one level, we get that. We understand all 3 of those families of concern. You know, what's right for my kid, what's right for our economic health, what's right for our personal health. We get that. But we also get this, that unless we take care, and by the way, that leads to more benign behavior. It's the underground play date. We were standing 6 feet apart at the end of the driveway, and we're not doing that anymore. You can't do that, folks. You can't do that. This is first and foremost. Of those 3 concerns that you rightfully have, for those of you with families, public health is number 1. It trumps back in the school's health without public health. And it's got to be that order of events. So I would ask you, please not only avoid just outright bad, hostile, stupid behavior, but also avoid the benign, let your guard down a little bit behavior. Because the minute we do that, that curve stops flattening, infections go up and not down, hospitalizations go up and not down, and sadly, fatalities go up and not down. We are on to something together. We can see the path to victory ahead of us. But we know just as certainly we have to continue to bear down. Please don't let your guard down, folks. I promise you we will get there. We'll get there together. We'll be stronger than ever before, but please don't let your guard down. Sam, fire away.
Good afternoon, Governor, and thank you for the time. We are hearing from a lot of our readers in the Pine Barrens area that you have authorized online automobile sales.
Online what?
Automobile sales. Vehicle sales.
Yeah.
But it does them no good if they cannot register their vehicles or their new vehicles.
Can you get closer with the microphone, Martel?
But it does them no good if they cannot register their new vehicles on the DMV website. Additionally, we're hearing from high school seniors and farm families that they cannot obtain the necessary documents to legally drive now that they are of age because DMV facilities are closed. Are there any plans currently in place to establish new vehicle registration and new license registration online, or at least establish specific appointments for these folks? I have two more questions, please.
Quickly, that was
Thank
a
you.
long
Of course, yes, no problem. One would arguably say that there are four aspects to this situation: health, public safety, the executive branch, and the economy. We're curious to know why isn't there an economic or business representative at these press briefings to give us an update on the economic impacts? And the third part is, like I said, we're representative of the Pine Barrens. A lot of mom and pop shops, businesses and organizations, and there's a lot of state assistance programs such as the NJEDA programs that automatically disqualify these businesses given the requirements that favor commercial areas. And we just want to know, many of these businesses in the rural parts are on the brink of bankruptcy if the shutdown lasts another 1 or 2 weeks, including Medford, Cedar Run Wildlife Refuge. What can you say to these businesses facing bankruptcy, and what is your message to these rural business owners about any particular relief efforts for these business owners in the
That's
relief
good.
parts?
I got it. Thank
you.
We can come back. Martel, can you go either that way or this way just a little bit? There, perfect. Paramel, help me follow up on the DMV question, if you could, in terms of what we could do online. Do you have any quick response to that?
Yeah, we've been in discussions with NBC about that. We don't have any news to break right now, but we'll come back to you.
I just got a note coming here, literally walking in, that we should consider doing marriage licenses online. New York is just announced they're doing it, and I think that's something we're looking at as well. So can we come back to you on the DMV question? And that includes high school seniors getting their their driver's license to drive, right? We want them staying home, though. Will you remind them to please stay home, even though we'll give them the license? We'll find a way to get them the license. We have economic representatives here all the time, and that includes me. I consider myself the head of sales, the head of the economic department in the state, but we had Tim Sullivan here, the head of the EDA. We had Rob Angelo here, who's the commissioner of the Department of Labor. We spent a significant amount of time this weekend talking about what both a health and economic recovery looks like. And we'll have those folks here from time to time without question. And mom and pop stores, will come back to you on the specifics in terms of their, it sounds like you're saying because of their rural nature of where they're located. I don't have a glib, quick answer for you, but we care about all businesses. And unfortunately, this just in, look at the amount of unemployment claims. It's tens of multiples of any historic high, previous high. The amount of small businesses that are either gone bust or may go bust. I'm encouraged, as I understand it, this 3.5 bill at the federal level has a big slug for small businesses. I can't tell you specifically how it impacts the rural small businesses, but maybe, Paramel, you could follow up afterward if that's okay. Thank you for that, please.
Good afternoon. In advance of the tour of the Atlantic City field station tomorrow, do you expect that to be as heavily utilized as the other two field stations, given that the numbers so far in South Jersey have been lower? And then continuing on that vein, do you still expect South Jersey to see a spike, or is there a chance that these leveling off numbers could indeed just level off and continue to go down? And then finally, you said that there are 73 testing sites in New Jersey, and that's not enough to start to reopen. What is that benchmark in terms of testing where we would need to get to feel comfortable doing that?
Great questions, and Judy, at a minimum, should come in here, and perhaps Pat as well, but may I say a word or two on this? I can't speak for what the capacity looks like in Atlantic City, but we have made a decision collectively that healthcare infrastructure, and by the way, getting federal money, as Jared rightfully pointed out, to maintain that healthcare infrastructure is a step that we have taken and will continue to pursue under the theory, whether or not we need the beds next week, or please God not, but 6 or 10 months from now, if this follows an H1N1 path, which God willing it doesn't, and we'll have therapeutics and whatnot in place to prevent that, we may need this infrastructure down the road, even if we don't need it in the next couple of weeks. I'll let Judy give you more details. I mentioned earlier in passing, but I'm glad you asked it, fair amount of discussion literally today on South Jersey. It was specific to Camden because of a Philadelphia Inquirer story that got a lot of people focused. Curtis Jenkins, who's a dear friend, city council president, just reached out to me as I was speaking. Spoke to Frank Moran, the mayor, Donald Norcross, I mentioned. I spoke to in an exchange with Camden County Freeholder Lou Capelli. We were discussing the fact that I think it was last week, Judy, the feds had highlighted Philadelphia as the next hotspot. And so we were having that discussion literally today. Is that happening? And what's the spillover in South Jersey? Judy can come back to you. I don't think it's, and again, the experts will correct the record here. I don't think it's number of sites as much as it is number of tests and how quickly. I think there's three or four pieces of the healthcare infrastructure that we're going to need to give everyone the confidence. Forget us for a second, everybody else out there, the confidence that it's safe to get back on the water, as they say. Broad scale testing, numbers you hear, and again, I'm practicing without a license, at least 15 or 20,000 a day. That would be at least double what we've got now. But probably far more importantly, is that tests you get back within 24 hours, not 5 to 7 days. That won't work. By the way, and I'm not marrying myself to 15 or 20,000 either, because that's probably a bare minimum. That's what some of the experts have said per day. Secondly, it's the contact tracing infrastructure as well. So what do you do? It's not just that you test, but what do you do if you've largely eliminated community spread and then you see a flare-up? You want to know that quickly, testing, and then what are you going to do about it? So how do you find out, I got it, let's everybody else here figure out whether or not how much contact you had with me, etc. And then thirdly is the process to isolate and quarantine. And then I think the fourth piece is what I've already said, which is healthcare infrastructure, including number of beds that are significant and are able to allow us to anticipate and get way far more out ahead of any other resurgence in this virus down the road. Judy, please correct the record. Thank you.
No, you were fine. I think we're not expecting the Atlantic Center to be as busy as we're seeing, particularly in Secaucus, but we are expecting, when we increase testing and the number of individuals that are asymptomatic that need to quarantine, not isolate, that would be a little bit different, but quarantine, we need to have that space available. As you increase your testing and you find positive cases and you have to contact trace, there will be people that cannot go back home, or perhaps they don't have a home to go back to. And if they're quarantine asymptomatic, the field is a place where more than likely they could be housed. So we're not only preparing for right now, we're preparing for the next 12 months, to be honest. Well, Camden has had a significant increase in testing, in positive cases. I don't know. I don't have the absolute numbers, but
I got it here. 2,255 in Camden County.
Yeah,
Camden County, that is. Pardon me.
It was almost a 2,000% increase.
Yep.
Is what they were reporting. So we're watching any dense population in the South, which there are fewer. We're watching them very carefully. I'm working very closely right now with Kevin O'Dowd in Cooper and the testing potential and capacity they have.
Kevin O'Dowd reminds me that we've said this before, but you've got a regional strategy, north, central, south. And Sharif El-Nahal is your point person in the north, Amy Madsou in the central, and Kevin O'Dowd at Cooper in the south. Ed, anything you want to correct the record on in terms of testing?
No, I mean, that was just about perfect. You may not be licensed, but you're getting pretty close.
I stayed at a Holiday Inn Express last night, as the ad used to say. I'm calling Sam and Andy Sam, so Andy, sorry about that. The reason why you get shouted out again is because Sue Fulton is watching, our commissioner of the Department of Motor Vehicles, and she said online sales through a dealer, you get a temporary tag that is extended every 2 months. and the only thing that's excluded are private sales. So if I sell my car to you or you sell your car to me. Thank you. Dave, welcome back.
Thank you, Governor, and thank you for the concern that was voiced. The issue of testing, do we have any updates? I know there was a lot of discussion and potential excitement about the spit test from Rutgers, because that could be a quick turnaround and mass produced. Any update on that at all? I know the president was talking about testing as a local thing. Even if we have 73, I think you said, different testing facilities in New Jersey, are we still waiting 2 weeks before we're getting results? And do we have a sense, you had mentioned contact tracing, if we have enough health department infrastructure, personnel in the local health departments to be able to do that once we start ramping up testing and then presumably could identify hotspots and then deal with them and so forth. The number of groups, Governor, and individual lawmakers calling for New Jersey to reopen in a slightly hysterical vein seems to be very small right now. But as we increase the capability for us to begin to reopen, are you concerned that this voice and clamor may increase? And how would you respond to these increasing calls to reopen our state? We may see other states start to do this that have not been as hard hit as New Jersey. And then finally, just to confirm, the hospital admission data that we're now getting, that we had asked about last week, we're talking about specifically for COVID-19 patients being admitted, yes?
Correct.
Okay, great. That's it. Thank you.
Okay. Thank you, Dave. Very quickly. Rutgers, staying very close with Rutgers. As we mentioned, they're doing I would say it's more than a pilot, but they're working with Middlesex County. I want to give Ron Rios and his Freeholder team a big shout out. And we are continuing to work closely with them, as we are with a number of different providers, including also in close coordination with the White House. Testing 2 weeks is no longer the reality. It's really more 5 to 7 days, is it not, at this point, in terms of getting 5 to 7 turnaround is we think what the norm is. The president has said it's a local thing, but the reality is it's a joint venture. You can't do all this by yourself. Again, there's sort of 3 rings of responsibility that I think we and our colleagues have. Jersey first, region, coordinate with the federal government. And right from the beginning, we just haven't had the national testing supplies that we need to do universal testing, which continues to be our objective. We have cobbled it together. I'm incredibly proud of the progress we've made to get to 73 testing sites, 7,000 and 9,000 a day from 0, but still not where we need to do, as you heard a minute ago, to give us the confidence to open up. We did hear today, and tell me if either of you heard it differently, that the CDC is going to explicitly put in 10 to 15 or 10 to 12, I forget which, individuals to help us coordinate in each American state to help us coordinate contact tracing. We're going to need a lot more than that. It's going to be, as I mentioned on the call with the Vice President today, both testing and contact tracing is a combination of both technology and manpower. But that is the first time I think we heard that. Am I right in saying, folks? That's a good step. But again, ways to go. We don't have the whole architecture by any means fitted out. Yeah, there are some, as I mentioned the other day, there's irresponsible behavior. I don't have to repeat what I said the other day. There's irresponsible behavior, but not much of it from elected officials. I have to say, on both sides of the aisle, folks have been overwhelmingly, even when we've disagreed on some stuff, have been incredibly constructive in their debate. And you get, I think, the most of our attention, at least as far as I can tell, is on parks, golf, and I mentioned earlier education, schools. And we would expect as the clock goes on, it's only human nature that folks, particularly as the weather gets better, take parks as an example, that so-called clamor, which again has been overwhelmingly responsible, There are a few that are not, but overwhelming folks have been, listen, we love what you're doing, but we really want parks open, and we've got to respond as we have based on the data we've got. We can't do that yet responsibly. I hope, as I've said, reminded folks, it's not a life sentence. That we'll get there, and I hope sooner than later. But the clamor, the fact of the matter is, this is about saving lives, and we're going to do what it takes to save as many lives as we can. We've lost too many already, and our job collectively is to keep that number, each one of these, never a number, by the way, an individual precious life, to keep that as low as possible. Judy, anything you want to add to testing, contact tracing in particular? Oh, hospital admissions, we already addressed that. That's COVID specific. Real quick, Dave, only because I love you. Come on down.
Any sense at all, Governor, about, we keep talking about we're going to have this testing increase. Is next month, May, at some point, do we think maybe, or is it going to be June? Any sense at all?
It's going to have to be, I'll answer it myself, it's going to have to be before we, with any confidence, open things up, which means in my opinion, we've got to be in a completely different place in the next 4 to 6 weeks, is the way I think about it. You good otherwise?
Just on testing, you'll see us roll out some testing of vulnerable populations over a shorter period of time to see how we do with it. So that'll be started within the next 2 weeks.
Yeah, so this is, among other things, taking what is now already happening, but make much more robust long-term care facilities, which has been a big exposure. Sir, do you have any? Can you hold on?
Governor, 3 questions for 3 of my NJ Spotlight colleagues.
I think I noticed Elise handing you one. Is that right? No.
Oh, no, I totally am.
Okay, just checking.
First, some experts are saying now may be the time to ban customers inside grocery stores. At what point do you think this would be considered, and is delivery only feasible? Last week, U.S. Department of Labor recommended essential retailers begin more drive-through and curbside pickup options. That's one. Number 2 is what is the protocol for the undocumented to get tested? Many obviously don't have cars and can't drive to a drive-through location. Can a hospital or emergency room turn someone away who is uninsured but has symptoms? And similarly, if an undocumented or uninsured person does test positive and needs care, must a hospital admit and treat that person? Number 3 is, do you have an explanation for the drop in hospitalized patients on ventilators? Could that have anything to do with the treatment trials underway, i.e. hydroxychloroquine or plasma? And are they reducing the severity of the disease? And is that something that you're actively investigating now?
That was a creative definition of 3 questions, by the way. No plans right now to ban customers in grocery stores, but we do expect operators to enforce the social distancing, the mask wearing, the hygiene that we have put through our executive order, and we expect adherence to that, period. I will let Judy come back, if it's okay, Judy, and deal with the homeless and the, not homeless, undocumented, pardon me, but nobody gets turned away in this state for health care. And the drop on the hospitalization on ventilators, again, I'll have Judy comment on that, but I think today's data didn't show that. It's down relative to maybe a week ago, but it's sort of, it's down only a little bit over the past couple of days. Do you want to hit either of those?
Yeah, on the ICU, I mean, let's talk about the trials, because I think that's the important part of that question, not just how it's affecting ICU. But there's a number of organizations in New Jersey, a number of hospitals that are in clinical trials to see the efficacy of hydroxychloroquine, to look at plasma infusions, and to look at the antiviral remdesivir. Though they're going on, and perhaps that adds to the number of patients in ICU because it's extending the life of the person in the ICU bed and maybe having better results. We obviously don't have those results yet because they're trials. But New Jersey, and particularly the larger organizations in New Jersey, are pretty active in treating the patients with COVID-19, and I think having better results than we even imagined a month ago.
Thank you, sir. Yes. Yes, please.
News 12 New Jersey here. As a follow-up to your order, the executive order banning non-essential construction, it seems like most of the major construction projects in the state are still going on because of one exemption or another. Do you know of any major projects that have actually stopped, and are you considering tightening some of those exemptions? And I have one more. Will you fine-tune any of your restrictions by region, since some of the areas of the state are seeing more growth of the virus than others?
Is that it? I'm not aware. We can come back to you. Mahan, can you come back with a question as to whether or not there's any large-scale construction project that was halted, if you could bear with us on that? And I don't think we're considering any other tweaks to that for the time being, Paramount, right?
Not at this point, no.
Yeah, not at this point. And the answer is, and I don't mean this from a healthcare perspective because Judy's got a regional strategy, but in terms of executive orders, you didn't ask this, but for instance, opening up parks in certain parts of the state and not others? No. No. Because it will have unintended consequences that we can't handle. And Pat will be the first to say, and there are some, and Pat lives in one of these counties where folks will say, hey, we're not as dense. We don't have as many cases. Sure enough, you open up one park in one county. We get some of the nicest parks in America, never mind the region. And the entire region will come descend on that park, including from out of state. So that's very separate from Judy and Ed in a healthcare strategy, which is very much regional. And so far, knock on wood, that has worked to good effect. But I don't anticipate. Paramount, would you disagree with me? Please feel free to. Everyone else does.
No, so far all of our executive orders have applied across the state.
Could I see it potentially, perhaps, but I don't see it in any realism. We got to go. Is Catherine, are you back there? I can't see you, though, is the problem.
Hi, how's it going?
Nice to see you. It's been a while.
You too. So in California, Governor Newsom announced a benefit fund for undocumented immigrants who can't qualify for unemployment. Is this something that you're considering in New Jersey? And then I also wanted to ask, are there any plans to change the state aid allocations for school districts? How should they be planning their budgets for the coming year? And then my last question is, hospitalizations, are starting to fall off, but are you seeing a greater concentration of hospitalizations in central or southern counties, or has there been an uptick at all?
That last one, certainly, Judy, you should jump in. I like, first of all, Governor Newsom is doing a great job. I can't say enough good things about some of the leaders that we are back and forth with constantly. Governor Cuomo is on that list. There are many. I saw it. I can't say that we've had any discussions about it, but Paramount is going to make sure to keep me honest. That's something we want to look at. We are, in many respects, as I've said so many times, the most diverse state in America, and that means that we are the immigrant state in so many respects, and that what he's doing is potentially quite relevant for what we're up to. Nothing new to report on state aid allocations. As you know, we've extended the fiscal year to September 30, which I know is complicated because God willing, we'll be going back to school before then. So I accept that that's something that has more urgency to it. I've committed to a budget by August 25th, I believe, at latest. And just to remind everybody, expenses are skyrocketing because we are the first responder to people who lost their job, their small businesses, somebody who's sick, and at the same time, our revenues have fallen off a cliff. So I want to repeat our plea for large-scale, big-time, many billions of dollars of direct cash assistance from the feds. In the meantime, also to keep on that table the notion of borrowing through the Federal Reserve, and it's not either or, that you could do both of those things and do them responsibly, but we need help from the bullpen financially. Judy, do you mind hitting the question on hospitalizations? Particularly, are you seeing a different texture to this based on the region?
We separate the state into three regions, and we actually look at bed capacity and available beds and filled beds, critical care and medical surgical by region. And what we've seen in the graphs that we see every day, because they're completed at 10:30 the night before, is that we see a little bit less use of beds in the northern region, but increasing in the central region, as you can imagine, especially the intensive care beds. So we're watching that very carefully. That's where the regional collaboration comes in, if we need to move equipment or if we need more intensive care capacity. So definitely seeing more in central right now.
I'll tell you, it just reminds again to say great news, but caution. The great news is you look at that map we show every day, you look at what you just said, Judy, particularly in the north, look at a Bergen County where it's taken now almost 3 weeks for this to double. Just extraordinary behavior. The problem is that behavior, the minute it changes, it can literally take us the other way. So just folks, again, please keep doing what you're doing because it's working. Sir, and Matt, we'll come back to you in a second here.
Kyle Mazza, thank you, Governor, for taking the time and for doing the briefings. I wanted to ask about the protests that are flouting around and people are saying they're going to protest to reopen the state. I wanted to know what your thoughts were on that. Thank you, Governor.
My pleasure. Listen, they haven't changed. I was asked, we'll come down to Matt next, Martel. They haven't really changed since I've been asked about it. They have a right to protest. I would prefer that they somehow do this virtually and that they're not out leaving home. We want people to stay home. Remember, that's still what we want you to do, and to stay away from each other. They have their right to protest. But I will say this, if you look at the facts, if you look at the data, if you look at the science, it is unmistakable what we should be doing, unambiguous, and that is staying the course that we're on. Stay home, stay away from each other. It's not a forever, it's not a life sentence, but it is unambiguous what our steps should be. So while I respect their right to protest, I wish they would do it virtually, from home and responsibly, number one, and number two, I literally don't agree with them. Literally just don't agree with them. They have a right to protest, but the facts are overwhelmingly on the side of doing what we're doing. Again, that won't last forever. We are right now meeting morning, noon, and night, figuring out what do we need in place. Where is this virus? Again, personal health creates economic health. Let's get ourselves healthy again, and then we'll get our economy healthy again. And I'll be the happiest guy in America the minute we can turn that dimmer on and get back to some sense of normalcy. Thank you. Matt.
Thanks, Governor. And speaking about testing, I'm curious to get your reaction to the Trump administration, specifically the Vice President, who you've mentioned, remarks about states having enough testing and there's plenty to go around. Also, the spread of the infection in Washington nursing homes was linked by the CDC to staff members working multiple jobs and taking the virus with them. Any consideration here in New Jersey to limit workers to only one facility? And real quick, you mentioned Blueprint, you mentioned earlier.
So is that long-term care specifically?
Nursing homes and long-term care, yes. You mentioned that you're going to be announcing a blueprint to reopen in the state. Curious just of a timeline about when you can expect that, maybe by the end of the week, and just kind of what we could expect to hear from that, Governor?
Yep. Listen, I think I'm going to say something which is from the heart. I'm on a back and forth with we all are, with all variety of federal partners. And for the most part, as I said, we've not had one call that hasn't been answered or returned. Now, we haven't necessarily always liked the answer. We've gotten stuff, but we've invariably needed more. There have been some extraordinary highlights, though. The Veterans Affairs team have been extraordinary. The Army Corps has been extraordinary. And FEMA, although at one point they were waffling on us, have been extraordinary. That must be said. And high on that list is the Vice President, I have to say. And I have to say that. He has been responsive. Again, we haven't gotten a fraction of what we wanted necessarily, but he has been responsive. I would just say with the greatest respect, we don't see it that way as it relates to testing. There is not, as far as we can tell, plenty to go around. And we've turned over every stone we can find here. We need more capacity, more materials. We needed it on a going-in basis, and we continue to need it. And I say that with the greatest of the utmost respect for him and for his office. Judy can come back to you on long-term care employees with Ed, but I think you highlighted right up front that you had the reality of asymptomatic workers in these long-term facilities unwittingly, and this is unfortunately not just a New Jersey story or tragedy that's unfolded, this is a national one, but please come back to that. And the blueprint, I would hope you would have some sort of a broad blueprint this week, and it will be broad, and I would guess it will not be specific as to timing, but it'll be a series of principles and values that will guide us as we sort of put, that are frankly already doing that, but as we sort of put the pieces in place to get back to some sort of new normalcy. Judy, would you add anything on either testing or long-term care in particular?
Well, I'll talk about long-term care. We don't anticipate telling CNAs particularly that they can't work and they must work in only one organization. There's a reason why they're working in several places. It's because the wages are not enough to support what they need to do to support their families, put food on the table, and they're working their little hearts to the bone here, just trying to survive. What I'd rather do is take better care of them, making sure that they understand their own health and well-being and how that's transferred to whatever patient they're taking care of at whatever facility.
I don't know what this looks like, so I'm just saying this as and disagree if you wish. Judy, you've forgotten more about this than I'll know. To say that we are going to accept the reality of the long-term care facility industry on a going into basis to this crisis as an ongoing reality, that will not happen. So there's profound, tragic, big and small lessons that all of us have learned at a national level and certainly in New Jersey. And I want to underscore what Judy said. We've got heroic employees, not just healthcare workers in hospitals, but in long-term care facilities, in veterans' homes, in psychiatric hospitals, in corrections facilities, in homes for the developmentally disabled, whatever it might be. And in too many cases in this country and in this state, they're not compensated what they should be compensated, the levels they should be compensated, and they've been going in without the armor that they should have had and need, and I would say no more acutely than in long-term care facilities. So that is, you can assume that's something that we're looking at in a very comprehensive way. I'll leave it there for the time being. Elise, please.
Good afternoon. On your Trump call, when you pressed for more cash for states, what was the president's reaction exactly, if you can say? And regarding the veterans' homes, how has Vineland managed to avoid an outbreak that was so widespread in Menlo Park and Paramus? How widespread is the testing in Vineland? And in a disclosure statement, your administration mentioned $5 billion in potential GO borrowing. Does that represent the total of what you would seek, or do you expect to add to that figure the Fed program and short-term borrowing? Last week you said the Fed program would cap New Jersey at $9 billion.
Without betraying a private conversation, but I think he said it publicly, and while I'm happy to hear this, I just want to reiterate something I've been saying. He reiterated privately, was a general matter, what's been said publicly, which is small businesses were the focus of 3.5. And also implying that states would get their, implying that states would get their attention in the next round. I would just say this, I want to help small businesses as much as anybody in America, but by helping small businesses doesn't mean that we can't help states. And we are the frontline reality right now. Both sides of the aisle would agree with this. We are the ones at the point of attack if you're sick, if you've lost your job, if you are a small business. And again, we want help for all the above, but for us to continue to be able to responsibly be there, we're going to need a lot of help, or the consequences, without getting into them, will be grave. And again, I want to reiterate, Senator Menendez and Senator Cassidy have a really good co-sponsored bill, Democratic and Republican sponsors. It's exactly what the doctor ordered. Before I turn it over to Judy, yeah, I think the answer is formulaically, Elise, as we do the math, we can do up to $9 billion. So I think we reserve the right to revisit that. Part of that answer depends on the one I just gave you. The extent to which we get direct cash assistance to the states, that puts us into a different place, and a better place, assuming it's a sufficient amount of support. Judy, any comment on why Vineland might be different from Paramus or Ed from Menlo Park? And I'm not sure
I don't know the specifics as to why that might be the case. Certainly this is affecting different facilities in a variety of ways for different reasons. Everything from luck as to whether it gets exposed to infection control, to all these different things can come into play. But exactly why Vineland versus the others, no, I don't know.
Elise, I think this is on there, just to repeat. This is, I think, today's census on Vineland. 300 licensed beds, 282 residents, 1 confirmed case, 4 ill residents pending a test, 2, I think that's 2 of whom are hospitalized, right? Is that 2 of the 4? And no deaths, thank God, please God it stays that way. And 1 staff person who has COVID-19, and none pending, and thank God no deaths among staff. Is that today's? John, please take us home.
Andover. Is Andover required to stop admissions? And if it is that the only facility in New Jersey required to stop that? And can we get details on the 11 facilities that were visited over the weekend? And are these deficiency reports available? Could they be made public? On Andover, you mentioned that you have to accept some of their changes that were required. If you don't accept them, what's the next step? What authority do you have next? And the nursing home numbers given today include confirmed deaths as well as probable deaths. Can we get probable deaths in the overall death total? If not, that kind of skews the number of deaths as a percentage at nursing homes. It makes it appear much larger than it is in general. And Governor, on Saturday, you telegraphed the possibility of significant layoffs. Are you making any preparations for furloughing state employees? Have you discussed things with other state your cabinet? Have you discussed things with legislative leaders? And are you making any plans for that if you don't, understandably, if you don't get the money?
I thought you said 21, not 11. That your team had visited.
21 facilities.
21 facilities.
Since Thursday, Friday, Saturday,
Yeah.
Sunday, 21.
I will leave it to you on the Andover and the 21. Now I'll leave my comments where they are. We've got to probably and both get a lot of federal money and borrow money through the Federal Reserve at historic, we don't know the details, but one would think at historically attractive rates. We need either or both, most likely both. And let's just hope that we get that combination in sufficient size. And we'll leave it there for the time being, because the consequences are too dire to even discuss financially. Judy.
Sure. I think we announced that we were doing 11 over the weekend, but we ended up doing 21 from Thursday to Sunday as more surveyors. Their N95s came in too large, but then we got the right fit tests, and more went out into the field. They were able to do 21. Their reports are written up and they are posted. I don't know the time frame, as soon as they can. They're more anxious to get out in the field and to see as many organizations as possible, particularly in the northern part of the state. If we don't accept what we've required from Andover, we do have the authority to place individuals in Andover.
With that, I'm donning my mask, as we all will. Thank you all. Just remember a concept that we said today more explicitly probably than we've said before. Personal health creates economic health. Personal health creates economic health. And that's our mindset. That's what all of our mindset needs to be. For the members of the press, we'll be together again tomorrow at 3 p.m. Again, apologies for the delay. We'll be at the Atlantic City Field Medical Station at 9:30 a.m. tomorrow morning. I will then do a run through, I think, Wildwood after that. We'll be back with you tomorrow afternoon. Details, we'll let you know the details on Wednesday. Commissioner Judy Persichelli, thank you. Dr. Ed Lifshitz, thank you. Colonel Pat Callahan, thank you. Director Maples, Paramel Garg, the rest of the team. Folks, again, personal health creates economic health. Stay at it. We're doing an extraordinary job. I mean, just an extraordinary job. But please, we need to stay at it, folks. And if we do, we'll crack the back of this damn virus and we'll emerge as one New Jersey family, stronger than ever before. Thank you.
All right, everybody, good afternoon. My name is Pilar Arias. Thank you so much for watching Fox News Now. Whether you're watching on coronavirusnow.com or you're watching on YouTube, I would like to wish you a very happy Monday. I hope you all had a great weekend. I had a fantastic weekend. I went to Superior, Arizona, where my mom was born and raised, so got out of Dodge for a little bit, got out of the house, had a nice little drive. It's a very short drive from Phoenix, and then I was able to take some pictures, do some hiking, so I highly recommend it if you can safely be outdoors, practice social distancing, get some fresh air, a little bit of exercise in. I highly recommend it. So I'm going to say hello to you again and happy Monday. So yeah, I hiked a total of 4 miles and I love hiking. It's just so nice to be outdoors, and especially this weekend when we're going to be approaching 100 degrees here in the valley. I might need to get out of town again, see if I can head up to Sedona or Flagstaff or possibly south to the Tucson area. There's some really nice hiking out there as well. So yeah, I posted some pictures of my travels, my little adventure. If you'd like to check it out, just search for me on Facebook, on Instagram, on Twitter. All you have to do is search for Pilar Fox 10. That's PILARFOX10, and find me and please connect. So like and follow and all that jazz. And I do chat with you all when you tweet me and write me messages. So again, I really appreciate it wherever you are in the world. So I do want to update the Johns Hopkins University map here really quickly, even though we're getting pretty close. We're about 15 minutes away from Maricopa County, Arizona coronavirus update, and we are preparing to go with that on Facebook Live as well. So many different avenues for you all to be able to watch these news conferences. So I just refreshed the Johns Hopkins University map. I need to make it full screen for you so you all can see it here. Here is the latest. They're saying worldwide we are approaching 2.5 million cases. It stands at 2,447,920. Unfortunately, worldwide, we've seen more than 168,000 deaths. That number stands at 168,500 to be exact. The good news here, the little silver lining in terms of COVID-19, check out that number on the top right-hand side of your screen. Not only is it in blue, but it is the largest number here on the graph that's keeping tabs of all the cases. That's how many people have, that's how many tests have been conducted, not how many people have recovered. But this is good news because, you know, we heard Dr. Anthony Fauci saying last week, testing is needed to end the outbreak. We need to know how many people are walking around asymptomatic, have no idea that they're carrying COVID-19 to stop the spread. So that stands at coming up close to 4 million tests that have been conducted. That's just in the U.S. That's not even worldwide. So we're coming up on 4 million tests right here in the U.S. Of course, the most in terms of states, New York, California, Florida, Texas, New Jersey, Massachusetts, Pennsylvania, Illinois, Louisiana, and Washington. So when we bring you all these different updates from across the country, we're taking you to the quote-unquote hotspots, so to speak, or the places where they are afraid there could be a spike in cases. So we continue to monitor everything for you as best we can. Here is a look at the live picture of the Maricopa County update that we should be getting in just moments. Until then, though, I'm going to take you out to Chicago, Illinois, where Mayor Lori Lightfoot had an update just a little bit earlier. Again, this is News Now on coronavirusnow.com and on YouTube. Again, happy Monday. Thank you for being here.
from their own work in addressing health inequalities and life expectancy gaps in 10 of our West Side communities. They are sharing their insights and relationships as we build this work across the South and West Sides of Chicago, and communities that are experiencing a different reality when it comes to COVID-19. One hugely important part of this effort is community-based leadership. This team has partnered with 3 anchor community organizations to help construct a leadership network that will be at the heart of delivering resources and information, as well as delivering the right approaches to fit these specific community needs. And I want to take this moment to thank these organizations for their incredible work, not just in this moment, but all the time, to really stand up and articulate the needs of a community that they serve in and specific concrete solutions. Carlos Nelson, on behalf of Arbon Gresham Development Corporation, Darnell Shields, on behalf of Austin Coming Together, and Anton Seals, on behalf of South Shore Works. I'd also like to thank the aldermen in these communities who have been engaged in this effort. Alderman Taliaferro, Mitz, Irvin, and Scott from the West Side. Alderman Moore, Curtis, Sawyer, and Hairston, Mitchell, and Harris on the South Side. It's these leaders and organizations and community members who are co-creators of our hyper-local approach, and we deeply appreciate the partnership. Moving forward this week and next, we'll be engaging with residents via 3 tele-town halls customized to share relevant information and have frank discussions about what's needed to protect residents and flatten the curve in these communities, just as we've done overall in the city of Chicago. We'll be focusing on developing solutions to food insecurity. For example, the emergency operations teams, the Emergency Operations Center teams are working right now on how to address needed food solutions on the South Side because of what we learned from Carlos Nelson's network on the ground. In Auburn Gresham, food insecurity has been flagged as a significant community need, and that local need has been elevated in a way that we can address it systematically as part of our emergency response to COVID-19. That's literally the work of this team in action. And increasing testing capacity and access to health care. And we're grateful again to healthcare leaders like Rush University Medical Center, U of C Medicine, Sinai Health System, UI Health, Lurie's Children's Hospital, and Advocate Aurora Health. They are all part of this process. And these partners are also ensuring our federally qualified health centers are also at the table. As we move forward, we'll be examining how we can proactively reach patients experiencing greater risk factors, such as age and underlying medical conditions. We're doing all this because it is what is necessary to make sure that we are meeting the needs of residents in this moment. As we saw from the shocking maps 2 weeks ago, we may all be experiencing this crisis, but we aren't experiencing this crisis in the same ways. The simple fact is that this disease has spread more heavily to some communities. As I said before, the health disparities that resulted in high rates of diabetes, heart and respiratory disease, and other maladies are the very conditions that this virus ruthlessly attacks. The maps we saw revealed more than just cases of COVID-19. They illuminated the broken and, yes, racist system of inequality that has held these same communities in the grip of poverty for generations, that has withheld access to health care, jobs, and education for generations. The very issues that place incredible burdens on our families before this crisis have only grown exponentially more during this crisis, and thrust into high relief how the issues of equity and opportunity are truly matters of life and death. We cannot simply stand for that here in Chicago. We cannot sit idly by while this disease devastates certain parts of our communities disproportionately more than others. These trends didn't start overnight, and they won't end overnight or by the close of this current crisis, but they must end. And I've said this before, one of the important things that we must do in meeting the needs and the challenges that we're facing in COVID-19 is everywhere build an infrastructure on which we can grow into the future. This can't just be temporary scaffolding. It's got to be the laying the foundation for a permanent fix to many of the problems that for too long we have ignored or said they're too big to solve. Now is the time. The sense of urgency is something that we all must feel, but turn this into an opportunity. I'm proud of the work that we've done so far, but I know, as everyone does, that we have so much more to do. Even now, before we are able to lift our heads from this terrible pandemic, I assure you we are doubling down our efforts to fight poverty, to end racial inequality, and ensure every Chicagoan, every neighborhood, every zip code has access for a bright future that they all deserve. These are tough times, but we are going to get through this because of all the hard work and the partnerships that we have across the city, because people all over the city love their neighborhood, love their neighbors. And if we treat our neighbors like ourselves, we will be better for it on the other side of this pandemic. And at this point, I'd like to welcome up Dr. Allison Arwady from the Department of Public Health.
Thank you, Mayor, and thank you for your really amazing ongoing leadership on this. I'm just going to be brief and give an update related to the data. So 2 weeks ago was when we first stood up here and started sharing some of the details related to race ethnicity. Every day since then, the epidemiologists at the Chicago Department of Public Health have been updating on chicago.gov/coronavirus the details related to race and ethnicity. So I'll remind you that as a city, we are 30% Black, 29% Latinx or Hispanic, 33% white, 7% Asian. Where we look at our cases, we are 46% of our cases are in Black Chicagoans, 24% are in Latinx or Hispanic Chicagoans, 21% are in white Chicagoans, and 4% are in Asian Chicagoans. We're at a total of 12,571 lab-confirmed cases as of today. And when we stood up here 2 weeks ago, we were at a total of 118 deaths in Chicago residents when we first broke out the race ethnicity. Just 2 weeks later, as of today, we are at 500 deaths among Chicago residents. And I just want to talk you through the race ethnicity there. 20 of the 500 deaths are still under investigation related to race ethnicity, or 4%. But among the remaining, 287 of the 500 deaths are among Black Chicagoans. 83 are among Latinx or Hispanic Chicagoans. 82 are among white Chicagoans. 23 are among Asian Chicagoans, and 5 are in other Chicagoans of other race ethnicity. So overall, 60% of our deaths remain in the African American community in Chicago, 17% in the Latinx community, 17% in the white community, 5% in the Asian community. I'll note that the death rate remains 4 times as high in the Black community as it does in the white community, and we have seen an increase, particularly in Latinx and Hispanic communities, since we reported 2 weeks ago. Thank you. Yes, next is Candace Moore, the Chief Equity Officer for the City of Chicago.
Thank you, Mayor. Thank you, Dr. Arwady. What has been clear from the start since the moment we announced the Racial Equity Rapid Response Team is that this work is about organizing quickly and collaboratively to deliver action. The Racial Equity Rapid Response Team has formed as a collaborative effort between government, health institutions, and most importantly, communities impacted by the most adverse consequences of COVID-19. And our list of partners continues to grow as both people and organizations come to the table with resources and strategies to meet the need. No data conveys the need more than the mortality instances that Dr. Arwady just shared with us. This data shows us that in no uncertain terms that the most devastating impact of this crisis, lives lost, lands much heavier in certain communities. To date, this mortality data has been our key compass in identifying where we would initially focus on, leading us to Austin, Auburn Gresham, and South Shore. The work we are building is about bringing a hyper-local public health strategy to these communities. This is about distilling down our strategies, contextualizing our work, and learning in real time where gaps and unmet needs continue to persist. To do this, we are marshaling the information and resources of the city, our healthcare providers, our public health institutions, businesses, faith communities, our elected officials, and our community organizations. As we shared, our focus is on 4 key strategies. Education. We will provide communication and updates that are relevant for residents and speak to the realities of their lives. We've already been working to diversify our methods and messages of our communications. The mayor mentioned it earlier, but I'll repeat that we're holding virtual town halls in each of these 3 community areas this week. South Shore will be this Thursday at 5:30, Auburn Gresham Saturday at 10:30, and Austin at 1 p.m. All town halls can be accessed by phone and live streamed through the community organization's Facebook page. Prevention. We are working to ensure residents have the resources and information needed to protect themselves and their families. This has included a team effort this past week, steered by Mount Sinai, to coordinate the dissemination of 60,000 donated masks across each of these 3 community areas. Along with those masks, we've also provided informational cards with targeted guidance, inclusive of essential workers and those living in multi-generational families. Testing and treatment. We continue to work alongside our health department to ensure that the expansion of testing and treatment goes in areas where we see the greatest need and is provided in ways that lower and or eliminate barriers to access. Support services and resources. We are working to ensure people have access to supportive services and resources that sustain their livelihoods. The mayor mentioned how we are moving forward to create more fit food access for the Auburn Gresham community as part of our work. This effort is about building a model that allows us to create adaptive solutions in areas where our overall strategies must go further and deeper. Throughout this effort, we will continue to let the data guide us. The map that has been highlighted has changed since we first began and will continue to change as COVID-19 continues to move across our city. Other patterns will emerge and make evident the need for targeted adaptive action. Patterns, as Dr. Arwady pointed to, such as the rising number of cases that we see in our Latino communities, and the problems we have seen with reporting. Reporting is an issue that our health department has already worked to address, and we have been working alongside them and with a number of other partners that have reached out to us about specific strategies and ideas that we should be taking in order to better reach and serve our Latino communities. This is alongside of all of the amazing work that is happening every day with our Chicago Department of Public Health and every day along all of the services that our entire city government is enacting to support our communities through this crisis. We are fortunate to also have some amazing partnerships that have formed to take our work farther than the city could do alone. Specifically, we are working with AARP to launch a racial equity COVID-19 communication strategy targeting 50-plus year-old Black and Latino individuals and their families. This campaign leverages the broad reach and base of the AARP to deliver messages and information on key resources in modes that are easily accessible, bilingual, and contextually relevant to the communities of focus. We are also partnering with a group of Black-owned Chicago-based advertising and entertainment firms in a targeted outreach campaign. The social media campaign conceived by Contender Labs in partnership with Spin Artist and Content Farm leverages the hashtag But Seriously in an insightful and creative campaign that will be launched this week to provide critical information through the comedic genius of some of Chicago's funniest comedians. Additionally, we are collaborating with different organizations, hosting virtual town halls and discussions, including the 100 Black Men of Chicago and the Urban League, who are working to create forums, virtual forums in which we can continue having conversations and gathering people together to talk more about what the needs are and what needs to be done. We continue to invite these kinds of critical partnerships to help us both identify need and deliver targeted resources. I am now pleased to pass it on to one of our key partners in the Racial Equity Rapid Response Team, Aisha Jaco, Executive Director of Westside United.
Good afternoon.
Good afternoon.
Over the past 2 weeks, Westside United has worked with the City of Chicago to convene the Racial Equity Rapid Response Team. The work of the newly formed Racial Equity Rapid Response Team is central to Westside United's mission, which identifies structural racism and historical disinvestment in Black and Brown communities as pillars of disparity and inequities. The immediate investments needed to address the COVID mortality and infection rates in high-risk communities also warrants a long-term commitment that this initiative can deliver by building the capacity of communities and residents to arm themselves with the tools and resources to stay healthy and informed. Westside United is committed to working together to decrease the current COVID mortality and infection disparity gaps in Black and Brown communities by ensuring that targeted West and South Side communities have structures in place that allow them to sustain a long-term preparedness plan that provides screening, testing.
All right, everybody, we're going to bring you right out here to Maricopa County, Arizona, where they're providing a coronavirus update, but in particular, it's talking about resources available for people. So everyone's coming in right now, should be speaking at the podium in just seconds, and we will be having it on Facebook Live as well. So regardless of how you are watching it, really appreciate you being here.
We're still trying to get the webinar up and running. One of our laptops decided to update right before this. So for those of you joining us by Facebook or by YouTube, and for our friends in the media who are here on the pool camera, we'll be starting momentarily. We're still waiting on it to join the webinar right now. I want to make sure everyone has an opportunity who's out there. News reporters that are joining us has an opportunity to ask questions today. So give us a couple of moments.
All right, everybody, so it looks like they're getting settled here to start this news conference. Let's listen in.
All right, so good afternoon, everybody. I'd like to welcome everybody to the Maricopa County News Conference on this April 20th from the Unified Command. My name is Fields Mosley. I'm the Communications Director for Maricopa County, and I'm also the lead PIO for the Joint Information Center that is here to support Unified Command. I'd like to thank our friends in the media, news reporters who are joining us here today, and I always have a lot of good questions. We appreciate you. Also, people joining us live via YouTube, thanks for being here. We hope you find the information useful today, as well as those on Facebook. Thank you for being here. Today's topic is about working together in times of crisis, because there are a lot of people behind the scenes that you have never heard about, nor would you hear about them until we are in a situation like this. But they train together, they work together with organizations like our emergency management group and public health for this type of situation, and then they help in our response. So these groups prepare with us all the time. They run through scenarios with us as well. Some of those organizations are part of what's called the Maricopa County Community Organizations Active in Disaster, or MC-COAD. So there's also, some might be familiar with Volunteer Organizations Active in Disaster, or a VOAD. So this is pretty common in the emergency management lingo. Obviously, that's new to a lot of people. So we're here today to talk a little bit more about that. And Robert Rowley, our Director of Emergency Management, will give you some insight as to how that was created not so long ago, and we are certainly thankful that it's in place today. Also, you're going to hear from Justin Chase. He is the President and CEO of Crisis Response Network. He is also a trained social worker. His organization is running the 211 call line that you might be familiar with, also the crisis hotline that is available to all residents at this time and during this time of need. We also have Dr. Rebecca Sonnenschein from Maricopa County Public Health. She will be available for questions today from our friends in the media. So, members of the media, if you've been a part of our news conferences so far, you understand how this works. You'll be called upon by our moderator after you virtually raised your hand, and then the moderator will open up your microphone. If you raise your hand, please unmute your microphone at that time, and that way it's available for you to answer or ask your question whenever your time comes. So please note, try to only ask one question. We've always been able to get back around to second and even third questions during these news conferences, so we'll certainly make that available to you today. If you're having difficulty raising your hand in the webinar or unmuting your microphone and the software seems to be a little glitchy, that happens from time to time. If you can't resolve it, don't keep clicking on it. It will block up the software. It's recommended that you go ahead and log out and then log back in to the webinar. So with all that information, I will introduce you now to our Director of Emergency Management here in Maricopa County, Robert Rowley.
Good afternoon. My name is Robert Rowley, R-O-B-E-R-T-R-O-W-L-E-Y, and I am the Director for the Maricopa County Department of Emergency Management. Last year, the Maricopa County Department of Emergency Management recognized the need to organize a group called Community Organizations Active in Disaster, or COAD. A COAD is exactly what the name implies and includes any organization that could have a role in a disaster response. The organizations come from the public, private, nonprofit, and faith-based organization sectors. The Maricopa County COAD was officially established just 3 months ago and now comprises 30 different organizations. The COVID-19 response is the first time the COAD has been activated for an emergency and is fully integrated into the Maricopa County Unified Command. Currently, COAD organizations are providing support for several missions involving people experiencing homelessness. For example, in our East Valley Shelter for At-Risk Individuals, Southern Baptist Disaster Relief is providing meals for 3 weeks, and the Salvation Army is prepared to provide meals after that. The Phoenix Tool Bank is supplying outdoor games and picnic tables for outdoor seating, and the Maricopa County Medical Reserve Corps is providing transportation for the tables to the location. Presbyterian Disaster Assistance and Hands-On Phoenix are providing hygiene kits and personal care items. Valley of the Sun United Way has supplied laundry bags, and Goodwill is prepared to make clothing and activity items available if needed. At our downtown Phoenix Medical Isolation and Quarantine Overflow site, the Salvation Army will provide hygiene kits, and the Arizona Humane Society is standing by to provide care for pets if needed. In addition to all of that, Maricopa County Medical Reserve Corps volunteers are staffing a call center which provides information to the public seeking COVID-19 information, as well as making hand sanitizer and helping distribute personal protective equipment. The Arizona State University Center for Emergency Management and Homeland Security is assisting with data collection, geographic information system tracking and displays, and volunteer help for website creation and workflow management. The Arizona Humane Society is providing care for pets of people hospitalized with COVID-19. The Crisis Response Network is managing information flow through 211 Arizona. The Phoenix Tool Bank is lending tools and equipment to organizations responding to COVID-19 and also provided 150 chairs to Justice Center, which serves homeless seniors and will help move activities outside. The Consulate General of Mexico is assisting with outreach to Spanish-speaking communities. Local food banks continue to provide food to those in need. And finally, the ASU Center for Emergency Management and Homeland Security, Arizona Humane Society, Phoenix Tool Bank, and Crisis Response Network are all providing liaison staffing to the Maricopa County Unified Command. As you can see from this list, the Maricopa County COAD is an integral part of our Unified Command. The services member organizations provide take considerable stress off of our limited government resources while simultaneously increasing the level of support we can provide our community. This is all part of leveraging resources and capabilities of the whole community, where it is recognized that everyone, from the federal government to the private citizen, have a role in responding to a major emergency. Thank you.
All right, thank you so much, Robert. I now want to welcome Justin Chase. He's the president and CEO of Crisis Response Network, and we certainly thank him for being with us today.
Good afternoon. My name is Justin Chase, Justinchase, and appreciate the opportunity to highlight some of the resources and services that Crisis Response Network offers here in the community. So we've been able to provide during this time response in addition to the crisis hotline and the peer operated warm line, being able to operate a COVID-19 response line through 211 and the ongoing support of information and referral services that 211 offers. On March 22nd, the 211 COVID line was activated at the request of Governor Ducey for us to serve statewide, and we've been honored to be asked to partner in this way to support the community. Individuals can contact the 211 COVID line for any questions and information needed related to the virus. The bilingual COVID line is accessible 24/7, but we have it staffed from 8 a.m. to 8 p.m. 7 days a week. Trained live answer specialists listen carefully to callers' needs and questions and their concerns and connects them with community resources as they need them. To date, the line has received over 25,000 calls and been able to assist more than 6,000 individuals through the 211 live answer capability. Trends that we're identifying through the call center are related to questions related to COVID-19, symptoms, how it's contracted and spread, who are vulnerable populations, and latest statistics regarding positive rates. Our second highest need that we're identifying is financial assistance. Individuals are looking for resources related to rent payments, homelessness needs, utility assistance, and eviction prevention resources. In addition to that, we're also finding a high need for food assistance for individuals and families that are in challenging times financially. In addition, the 211 is partnered with Maricopa County to offer support for employers who may have questions or concerns regarding their operation during the times of the COVID-19. The crisis hotline continues to operate 24/7, available to anybody in the community that's experiencing a challenging time or having difficulty coping with the latest situations. Trained crisis specialists provide support and information telephonically, and if necessary, can dispatch a mobile crisis team or coordinate with a community partner to engage the individual face-to-face. Crisis line data to date for March, we wound up with 22,000 calls into the crisis hotline from Maricopa County. That is an increase of 10% from the prior month. We are seeing a drop in children's related calls significantly, primarily tied to the closure of schools at this time. We're seeing an increase in adult calls related to anxiety and medical concerns, and we are currently, as expected, seeing a decrease at the time for depression and suicidal ideation related calls. Mobile crisis team dispatches are down by 10%, and that is expected at this point because of the fact that the schools are closed at this time. So our children's related calls are down, but we're seeing an overall increase in 9% for adults, as well as a 19% increase from requests from law enforcement and first responders in the community. It's natural for folks to feel anxious and unsure during times like this, and everybody responds differently to heightened levels of stress. The CDC has identified individuals who are more likely to experience stress and challenges during this time, older individuals and individuals with chronic conditions, children and teens, people who are helping to respond to the COVID-19, including healthcare workers and first responders, and people who have existing mental health challenges and potentially challenges with substances. To support yourself and others during these difficult times, it's recommended to take breaks from watching, reading, and listening to news, including social media. Hearing about the pandemic on a repeated basis can be unsettling. Taking care of your body, taking deep breaths, stretch, meditation, and mindfulness, trying to eat healthy and well-balanced meals, exercising regularly, getting plenty of sleep, and avoiding alcohol and drugs. It's important to make time to unwind, try to do some other activity that you typically enjoy, and connecting with others. We're physically isolating at this point, but we want to maintain social connectivity with others. So talking with people you know and trust, and talk about your concerns and how you're feeling. If you're concerned about a loved one, please reach out. Please engage with them. Ask them how they're doing. It's important during times like this that we connect even more. Please know that the crisis hotline is available 24/7 at 602-222-9444. That's 602-222-9444. In addition, the 211 system is operational 24/7 at 211, and you can achieve this through your telephone system. I'd like to thank you for the opportunity this afternoon, and I appreciate it.
Thank you so much, Justin, for joining us today. Justin Chase from the Crisis Response Network joining us today. So at this point, we'll open it up to questions from members of the news media who have joined us via the webinar. And Chad, do we have anybody who has their hand up?
We have a couple of questions. Our first is from Rachel Langen. Rachel, your microphone is live.
Hi, Rachel Langen with the Arizona Republic. I'm wondering, from a public health perspective, what do you guys see as the steps that are needed before the economy can reopen?
All right, thank you, Rachel, for that question. I'll invite Dr. Sonnenschein to come up here and address that.
Good afternoon. We're currently reviewing the President's recommendations and working closely with the Arizona Department of Health Services and our other local health departments to determine when it will be safe to start opening up businesses and other operations.
All right, thank you, Dr. Sonnenschein. Thank you, Rachel, for that question. Do we have another question?
We have one more question from Leon Gonzalez. Leon, your microphone is live.
Hi, thank you for your time. I think I have a glitch, as you mentioned, because my hand looks here, in red and on raised, but I'm going to take advantage. Thank you for your time. And I would like to know about depression, anxiety, and also we were struggling as a state and as a country with overdoses in recent months. And I would like to know if there's also an increase in this area.
So an increase in overdoses, anxiety, depression. So an increase in overdoses specifically, Leon?
Correct.
Okay. I'm not sure if we have that kind of data, but I think Justin might be able to cover this more broadly, at least.
Yes, regards to the question regarding substance use rates, increased use in drugs that result in overdose, I don't currently have statistics on the any trends related to overdose increase, but we are seeing with an increase in anxiety and a continuation of needs for depression and the calls that are coming in related to substances, we are seeing an increase at this point in those related calls for substance use.
So, Leon, I know that doesn't exactly answer your question whether or not we're having higher levels of. We do know if it's the the data that's coming in and the number of calls we're taking certainly would seem to lead us to believe that there's a higher level of anxiety that's certainly natural in the situation we're all in right now with the pandemic, but we just don't have that data on whether or not there's a higher level of overdoses in the community right now. So, Chad, do we have any other questions today?
Yes, Rachel would like to ask a follow-up. Rachel, your microphone is live.
Hi, sorry, I had a follow-up
Sure.
to the question for Dr. Sonnenschein here. Can you provide any details? For instance, do we need more testing? Do we need better contact tracing? Things like that before we can reopen businesses?
All right, thank you, Rachel, for that question. Dr. Sonnenschein's addressed this before, and she'll come up and answer this once again.
What's in the president's recommendations and what all of the experts are looking at is what conditions will put us in the best position to be able to begin to relax social distancing and open up businesses and operations safely. And we know that among the things that are important is having enough testing available so that we can have accurate surveillance. It's also important to be able to have enough healthcare capacity so that if we see a surge in the number of patients who need care, require hospitalization or intensive care, that we're able to meet those needs. And it's also important that we have the ability to be able to monitor things and do our contact investigations to the best of our ability. We have been able to maintain case investigations throughout the outbreak and contact investigations. However, we are not currently able to do them at the full capacity, and that is something that we are trying to maximize to make sure that we are implementing every public health related surveillance activity that we possibly can, so that if we do see changes after we relax things, we'll know about it right away and we can make the appropriate decisions working together with the health department and with the governor. Thank you.
Thank you, Dr. Sonnenschein. Thank you, Rachel, for that question. Chad, do we have somebody else?
Juan Juarez has a question. Juan, your microphone is self-muted. If you can unmute it, we'll be able to get to you. Okay, Juan, your microphone is live.
Okay, great, thank you. So I guess this is for the doctor. We've seen a lot of different groups protesting throughout the country recently, demanding for the reopening. We supposedly have a group here locally that's doing that as well. Are they putting the rest of the population at risk? And if so, what is the county or the state trying to do to address this?
Juan, I certainly respect the question and appreciate the question, but that's not a question for public health right now. Are they putting people at risk? I think it depends on how they're protesting, what they're doing, and are they putting their own safety at risk if there's disease within that particular group. From what I saw yesterday, people were driving around the Capitol and that sort of thing. They're certainly in their own vehicles and not gathering en masse, but I understand the intention of the protests is the same. So, that's not our call to try to stifle a public assembly or anything like that. And we certainly wouldn't make that call. So that's really not a question we can answer here any more than I already answered it. So I appreciate the question, though. Chad, do we have anybody else on the line?
That was the last question.
Okay. If we have no other questions from members of the media for our subject matter experts here today, thank you so much for joining us on the webinar, and we will let you know of our next availability. Thanks again.
All right, everybody, so that was the latest here from Maricopa County, Arizona. I do want to show you how stocks are doing one more time. Currently, trading is done for the day, but ended about almost 600 points and nothing but red on the big board today. So we are preparing for as soon as the coronavirus task force briefing happens. We do have a separate stream for that, and we will show it in its entirety live, and then we will clip it on YouTube for you to see as well. Remember, we're all about live here on News Now and on coronavirusnow.com. We do have a live briefing going on right now. It appears that this is the Georgia governor news conference on coronavirus, so we're going to listen in right now on News Now, and then depending on what happens, we've got tons of other updates from across the country as well to bring you. So again, thank you for being here. If you're on YouTube, please like, share, subscribe, and let your friends, your family, your coworkers, your neighbors know this is what we do on YouTube for a lot of hours throughout the day and on coronavirusnow.com 24/7.
National Guardsmen. So many people are working so hard against what I call a monster, the monster of the coronavirus that has upended lives and has really changed life for Georgians in ways that we will never fully grasp. We will never get back to normal, but we will find a new and better normal. Because as we are here today, we are here to take steps toward reopening the state. And as the governor said, these are measured, balanced steps. They don't go as far as some would like, but I think they go as far as we can responsibly go at this time. And I think that we have struck a good balance between putting people back to work. You know, this virus really is touching lives of many, many, many Georgians. I was reflecting as I was listening that somewhere in this state this afternoon, there are many Georgia families, many business owners that are fearful about what lies ahead, fearful about watching their business go away that they have devoted a lifetime to, fearful of not having a job, fearful of how they're going to take care of their children. There are other Georgians who are probably getting the news this afternoon that a loved one has died alone. But this is touching so many people so deeply. But I think that we have taken measures today, and I want to applaud the governor for these steps. They are small steps, but they are responsible steps for a problem that you can't solve with a slogan or a bumper sticker expression. It's going to take a lot of hard work. It's going to take following the science and following the data. And I think that's what we have done to the best of our ability in this. And so as Georgians, it is important that we stay together. You know, the community I live in has embraced the slogan, "Stronger Together." And that's truly what we have to embrace as an entire state, is that we will only be stronger if we are together. So may God bless all of you, and may God bless the great state of Georgia. Thank you very much.
Well, thank you so much, Speaker Ralston and Lieutenant Governor Duncan, for being here today, but also for your strong support, and we look forward to continuing to work with you as we fight this enemy and also work on the budget and getting our economy back to the great place it was before all this happened. I had a call today with the Vice President and the nation's governors, and the Vice President called on me to give an update on what our National Guard's doing. And I think our state can be proud of what General Cardin and his team is doing to help get food to the needy across our state, to sanitize our long-term care facilities and many other facilities, training people in those sanitation practices and protocols to stay safe in those environments, working with our prisons, working with industries, food processing industries, and also training other states. So we're very proud of what the National Guard's doing. And General Cardin's going to talk about the working on the last few days. General Cardin.
Thank you very much, Governor. Certainly proud of your Georgia National Guard and the things the Governor just mentioned. As of today, we have sanitized more than 523 long-term care facilities in Georgia. That brings us to 66% of the 790 long-term care facilities in our state, and it's our honor to make those most vulnerable among us a little bit safer. With respect to the new mission, the Governor asked us last week, and in fact it was a directive, it didn't come in the form of a question. He wanted us to partner with both GEMA and the Department of Public Health and academia to bring those teams together and see what we could do to increase testing. And the Governor covered the most important tenets of improving testing in Georgia. So at the end of the day, this program involves a couple of strategic initiatives, one of which is a 24/7 operations center that will be run out of Augusta University, and that will serve as Governor Kemp's unblinking eye on coronavirus. And what it does is it enables workflow, it manages logistics, it works very closely with the Department of Public Health and all those initiatives that are currently underway to bring it all together and make sure that we're sharing information and increasing both situational awareness and situational understanding across the agencies and across academia. The Governor also mentioned our mobile strike teams, 10 of which we stood up on Friday. Over the weekend, we tested 963 Georgians in our long-term care facilities and among our law enforcement and first responder community. Today, we intend to test 1,500 Georgians in similarly disposed areas across our state. We can scale that up very quickly. The number of tests that are available to us. And so as we link those initiatives together, we'll be able to paint the picture, if you will, for our governor, for our state leadership, and particularly for Dr. Toomey and her department as we